Hello, 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 everyone. Welcome to day 3 of TMF Week. Thank you all for joining us. We're going to let people come in slowly. Just wanted to say thank you for joining us once more for our 9 a.m. session. And I just wanted to know if you guys can just give us like a shout out by giving thumbs up or writing in the chat that you can hear and see us. So we'll just take that minute to see if you guys can hear and see us. And if you can, just kind of drop in where you're dialing in from as well. That would be kind of cool. We'd like to know where our attendees are from. Got a thumbs up. Excellent, perfect. People are hearing us and they're seeing us. I'm so happy to hear that. Excellent. So before we begin, we have to go through some rules. So of course, the most asked question during the TMF Week conference is, are the sessions going to be recorded? The answer is yes, the sessions are going to be recorded. You'll also be provided the slide deck at the end of each day. And an email is always sent out just giving you a recap of all the great sessions that are being presented every day. All attendees will receive an attendance certificate, so be on the lookout for that. If you attend one session or more, you will be receiving an attendance certificate so you can show off to all of your peers and friends on LinkedIn. Questions will be answered at the end of the presentation, so make sure to get your questions in the Q&A section on the left side, on the right side of your screen. You'll see a little bubble with a question mark. Please enter your questions in there, and Paul and Karen will definitely be answering them at the end of their presentation. And just to let you know that networking break will be followed after every session. So make sure to head over to the lounge, rub elbows with peers, connect with them. That's what TMF Week is all about. It's connecting and building that community. And just to let you know, the session runtime will be around 30 to 35 minutes, which will leave us with 10 to 15 minutes for question and answers. And we will be telling you exactly what the next session will be after this one. And of course, don't forget about the networking break. So without further ado, I would like to turn the mic over to Paul and Karen for their session, Charting a Course to Standardization, the Future of the TMF Reference Model. So I'm just gonna hand that over to you guys. If you can, Karen, you can share your screen.
Absolutely.
Excellent.
Good morning, good afternoon, everyone. Nice to see so many of you here.
Yes, indeed.
After 3 days, it's a lot of sessions.
Yeah, I get an easy job. I just have one presentation.
Yeah.
Easy. Right. Okay. So welcome everybody to Charting a Course to Standardization. So we're going to head off into this presentation up into the clouds and talk about lots of stuff today. Me and Paul and I are going to, hope you enjoy it. I would say questions as they go. If you have questions, drop them in as we go. We don't need to wait to the end because we might be talking about something specific that you want us to focus on. So, welcome to TMF Air. You need to get ready for the reference model to take off. We're heading into a new world. I am the air hostess, Karen Roy. I am working with CDISC, and I'm here to tell you to please strap in your seatbelts. The emergency exits are in front of you and to the right, but you're not allowed to leave, obviously, because you're stuck at home or in the office, and you need to just listen to us. And obviously, for this ride to carry on smoothly, as an air hostess, I clearly can't be driving it, so I therefore need a pilot.
Thank you, Karen, and welcome to today's flight. I'm Paul Fenton, and I'm going to be piloting the plane today. We're going to be, first of all, charting a course around the history of the TMF reference model and the reasoning behind our journey towards CDISC. And then finally, as we approach our destination, we'll be talking about where we're going next in terms of standardization. So sit comfortably, make sure that your seatbelts are fastened and that your tray tables are latched, and have a enjoyable flight.
Thank you very much, Mr. Pilot. Okay, so I'm actually going to take you back, first of all, and talk a little bit about the reference model. But before I do, and I should mention that this was actually at the EU interchange. For those of you who we're going to be talking a lot about CDISC today, and we had a conference in Copenhagen. So this was the presentation we did for Copenhagen. Now, before we head off on our journey, I want to know a little bit about, from everybody here, we have a poll. So what do you know about CDISC? Now, when you go to the polls, you'll notice it just says A, B, C, D, and E, because I wrote too many words and we couldn't fit them in on the screen. But pick one of those 5. Either you know that it's part of CDISC and you know CDISC, or you know it's part of CDISC, but you don't really know who CDISC is. You know CDISC, but you didn't know the reference model was part of it. You don't know CDISC and you didn't know the reference model was part of it. And then the last one, what is the reference model? And I'll be curious I'm always curious to see if we ever get people saying, what is the reference model?
Excellent. Just wanted to let everyone know to move over to the right side of your screen. I see that answers are coming in. Just click on the poll tab and you'll see that the poll is running. So we'll give you guys a few minutes, or I should say a few seconds, to answer and get your choices in. So it's kind of fun to see it coming in real time. It looks like a race, so it's kind of cool.
What's actually quite interesting, Paul, is the fact that it wasn't that long ago that I think A would have had almost nobody answering it, as because I just don't think people knew who CDISC were. So clearly we're managing between us to educate people on what CDISC is. We do have, I'm thinking that's 1 or 2 answers that said they don't know the reference model. So please, please, please get hold of somebody. Email Kim afterwards, or Oliver, or somebody, and ask about the reference model.
And now we're going to end the poll, and we're just going to show the results to the audience.
Okay.
Excellent.
So around 20% still didn't realize that the reference model was part of CDISC, and they didn't know CDISC. So we still got a little bit of work to do in getting the message out, but at least everyone's going to sort of learn today why it's so important that we're part of CDISC.
Absolutely. Excellent. Okay, so what we're going to do now is take a little step back. For the people that maybe don't know the reference model as well, not spend a large amount of time on this, but just a little step back and, oopsie, wrong way, a little step back and talk about the history of the reference model. Now, I don't know, and I'd actually love anybody to comment in the chat, who still calls it the DIA TMF reference model? And the reason I want to know that is because I get asked so many times, I'm sure Paul does as well, is it the DIA, you know, what's happened to the DIA reference model? So the DIA reference model wasn't DIA after about 2014 and is now the CDISC reference model. It's all the same thing. So it's not that there are 2 models, there's only 1 model. So guys, stop calling it the DIA reference. And I love that. Most of my colleagues, that's funny because it's true. So many people just keep calling it the DIA reference model.
Yeah, it sticks.
It's the CDISC reference model. Okay, so history started in 2009. A lady called Lisa Mulcahy and I started it. We then dragged everybody in as quick as we could, and Paul got dragged in within about 30 seconds. And that's it. We then headed off and we created this reference model. We created it. We got it reviewed by the regulators. We added in all sorts of things like site files and devices and et cetera, et cetera. And then we decided we had to be a bit more formal. So we formalized it with the steering committee. Paul's been on the steering committee since the very beginning with me and a number of other people. And we also had the release of the exchange mechanism, which is Paul's baby as well. And then we got to a point where we said, okay, what are we going to do now? Because we want to put it into a database, we want to do loads more, and we really don't have either the resources or the ability to sort of take it forward and become more. So we agreed that we were going to join CDISC. Oopsie, I'm on the wrong side of the screen. There you go. So why did we decide to join CDISC? So probably the biggest reason is it's an organization. It's a non-profit organization, so it's not about trying to make money out of things, but it's an organization with actually 50 staff now, and it's a standards organization. So they have CDISC have a very established framework for developing standards, and that's what Paul's going to be talking about when we get to that group. It's recognized by regulators. Very excitingly, we as a group are registered on the EMA database, which we could never do before. We have a voice. We are, through CDISC, having a voice in interactions with ICH, with Transcelerate, and it's made us a much more recognized body as such. CDISC has databases, libraries, which I'll talk about a bit, which is going to allow us to take the reference model and not just have it as a flat Excel spreadsheet, but have it as a database where we can look at it from different angles. They also have a fabulous education team, and I'll talk about that in a bit. They have a fabulous marketing team. I'll talk about that. But most importantly, and one of the things we always try and address, is the reference model will stay freely available, and the outputs that we do as a community will stay freely available. So a little bit about CDISC, and I'm not going to go into great detail. If you want to learn more, there is an introduction to CDISC training course which you can take. But really, just to say that CDISC creates these standards based on consensus, and CDISC standards are really focused on the sort of stats programming end of the clinical universe. And that's what it's been up until very recently. But really, CDISC is now trying to become more of an overall clinical research standard. And we, as the TMF reference model, joining CDISC, have started that journey. There's another part of the journey which I'm going we'll talk about at the very end, which is also not necessarily in that very data-driven space. All standards are freely available, and exactly like the reference model, the standards are developed, they're used globally, and they're developed by a team of volunteers. There's a library. We're not in the library yet. It might look like we are. Please note we have a new logo as well. But the library is where we're going to be putting the reference model and how we're going to be able to extract the information from the reference model to be able to be used, working through APIs, etc. This is also a very, very important slide, because CDISC has so many different touch points with different groups, with regulators, with academic institutes, with industry bodies. It is globally recognized, and that means that we, as part of CDISC, are now globally recognized as part of that organization. So what have we done so far? Well, we took a long time to make the decision. This wasn't a decision that was taken lightly. We really, as a steering committee, we did what's called a strategy on a page, where we really dug very deep into what we needed and why we needed it. You can see the 4 pillars on the right, which we'll talk about a bit later, but they were the strategy pillars that came out of what we wanted. And we went and looked at lots of different organizations and eventually decided to settle on CDISC. We signed a memorandum of understanding in April 21. And so it's been just over a year now. and we created an implementation team, and we started really integrating. So as the chair of the steering committee for the reference model, I sit on the CDISC board as a non-voting member, which is very insightful because it means we get to see what's happening. We've had a lot of publications through press releases. We've done presentations like this at the different conferences and summits. Volunteers have been moved over. If anybody is interested in volunteering, there is a process that you can follow on the CDISC website. And things like the LinkedIn group have been moved over. The website is currently being moved over. It's actually, there is a version of it hidden at the moment on the CDISC website. So hopefully that will be relatively soon. And we've started working according to CDISC sort of processes. So change control is now on the CDISC website, and the sort of overall process for managing changes is following the CDISC process after the next version. So where do we go to from here? Well, there's lots of different things that we can be doing, and I'm going to talk about a couple of them in a minute. But I think one of the key things that we're doing is really pushing people's knowledge of the reference model and the touch points of the reference model out in the industry quite a lot. Just a quick comment to say that we have now got our general meetings that are running every quarter. So we used to do them every 6 weeks. Our next one is on Tuesday, the 23rd. You do need to pre-register for it. So if you want to attend that meeting, it's at 11 a.m. Eastern, 4 p.m. UK, 5 p.m. Central, and you need to go onto the CDISC website to register for that. So let me talk briefly about the new initiatives. I'm going to do the first two quite quickly, and then I'm going to hand over to Paul to talk about the standards team. So the first one is the education team. So the education team is made up of an amazing bunch of people. So Donatella, who you've been listening to, she's on the education team, along with educators from many different organizations. And bringing those educators together, we are actually creating our very first Foundations of the TMF Reference Model training course, which is going to be released in September. And this is going to be a course that is a full day course, and it covers sort of every aspect of TMF at a very high level, obviously. We'll then be developing a whole group of extra courses that will be available as formal CDISC education. Up until now, it's sort of been us recording some videos and then putting them on a website. So that's the first exciting initiative. The second exciting initiative is even more exciting. This is our first annual conference. It's going to be in Baltimore, 28, 29. So 27 is the workshop, or the training course, I should say. 28th, 29th. It's different. It's different in the sense that the only people who get to present are those who put in abstracts. So there is a program committee who will be looking at the abstracts. The abstract request for abstract ends on the 31st of May, and then the program committee will look at all the abstracts and decide who's going to present. So unlike some of the more commercial conference vendor run conferences, it won't be people who effectively pay to present. It'll be through merit, and it's going to be very interesting because there's going to be a variety of topics, especially covering off things like the sort of technology, the standards, the move to integrating the TMF into everything else. So that is the program, the TMF interchange. Now, the third one is obviously the standards team. So, Paul, would you like to introduce yourself potentially for those people who don't know you?
Yeah, sure. So thanks, Karen. I think it was really good info you just gave everybody, and make sure you submit an abstract for the interchange. We need your abstracts. Great to be here. I'm Paul Fenton. I am the CEO of Montreal, but I'm also a member of the steering committee for the reference model, and I'm the chair of the new standards, so TMF standards subgroup, which is a subgroup of the reference model to develop the reference model into a standard. My background has always really been in technology, clinical technology. I started my career early on in the data management and biostats space, so I know quite a lot about CDISC from my early career and have been following it ever since. So I'm really happy and excited that we're now part of CDISC, because there's a lot of potential. So I'm going to talk to you a little bit about the standards team, what our remit is, what we're focusing on, what our objectives are, and what we're currently working on and where we're going. So Karen, can you move to the next slide? So before we sort of talk about our objectives, I just want to talk about where the reference model is today. So all of you know the reference model is currently an Excel spreadsheet. We love it. We've been using it for years. Everybody knows it. We know the columns, we know how to use it. The problem is it's quite limited. Because there's only so much you can do with a spreadsheet, and especially as we want to start to map the reference model into other models and standards, and we also want to sort of expand it from a metadata standpoint. So there's a need and a will from the industry to have more standard metadata as we start to exchange more information between systems and as we become more and more digital. And we also, of course, have standard metadata for the exchange mechanism standard, and we also want to expand that too. And so we needed, number one, to move more towards a standard and cease becoming just a model. And there's a difference between the two. Obviously, a standard is much more formal, but also we needed a new home, and that's where CDISC came in. And so we're now ready to embark on this journey of transforming the reference model into a formal standard as part of the CDISC family. So let's move to the next slide. So the TMF standards subgroup was established at the end of last year, so December 2022. And our primary objective is to oversee the move of the reference model from a de facto standard to a formal standard. And so a de facto standard is basically something that everybody's actually using, but is not necessarily being managed in a formal way. And if we look at the industry, I would say, at a guess, it's probably around 99% of organizations are using the reference model today to manage their TMF. There are still some stragglers, but the vast majority. And so it's important that we ensure that the reference model obviously has perennity, that it carries on, but also we do need to introduce some formality around it. And so that's what we're doing now. The subgroup has 4 different initiatives or 4 different work streams. The first is to migrate the reference model from the spreadsheet to the CDISC library that Karen was talking about earlier. The second initiative is to continue to evolve the exchange mechanism standard and focus on interoperability of information between systems and organizations. The third is TMF Reference Model standards, alignment and management. So this is all about processes. And then finally, development of control terminology and alignment with ICH M11, so the new draft guidance on digital protocols. And it's more than a guidance, actually, it's a standard. So next slide. So initiative 1, let's talk a little bit more in detail about what it's all about. So the primary objective here is to move away from the spreadsheet and move into a more dynamic format, which will allow us to be able to better consume and better work with the reference model, but also even to improve the way that things like change control work with the reference model, and allow us to also develop relationships between artifacts and things like that, because it's a much more sort of relational environment. So the CDISC library is for all intents and purposes a database where all of the CDISC standards live, as well as the control terminology that has been defined for CDISC. And all of those standards are managed within that library. And as you saw in the diagram that Karen showed earlier, there are also a series of APIs that can be accessed to be able to query the library if you need information. So that's quite interesting and useful for system vendors who want to be able to integrate. You can also search the library. So if you're looking for something specific, and I think for the reference model, that's quite useful because obviously the reference model is quite big. There's a lot of stuff in there. And so being able to search and find very quickly specific artifacts will be very useful. And eventually to be able to see the relationships between artifacts as well. One thing that was important to us was the ability to still extract the reference model in Excel if we wanted to have an Excel extract. And we should be able to do that with the library, as well as having maybe subsets of the reference model. So if you just want to see, for example, what are the artifacts that relate to real world studies? Well, you should be able to do that and extract that into an Excel spreadsheet. So the big advantages of moving to the library are, number one, the ability for us to expand the reference model, so notably around metadata, better change control and version history, so you can see over time how the reference model has evolved, make it more easily mappable to other models and standards, and then to be able to define submodels for different types of trials, for example. So this is the kind of thing we should be able to do once we have it in the library. It's quite a big job to get it into the library, and then we also need to kind of evaluate beforehand, do we need to make any changes before we move that over? So quite a lot of work to be done, but we've got a really keen group of volunteers that are all ready to get started on this, and we will be launching this activity in the next few weeks. Next slide. Initiative 2 is everything around the exchange mechanism standard and interoperability. So as some of you may be aware, we developed the exchange mechanism standard over the last sort of 3 or 4 years, and we released it around 2.5 years ago in its first version. And what it is, it's very similar to ECTD. It's basically a way of producing kind of like an inventory of TMF content that you want to transfer with all of the metadata and audit trail information, as well as the files and then checksums to be able to verify the integrity of what's being transferred. And you basically have an issuing system and then a receiving system. So it's quite a simple mechanism. For those of you that work in regulatory, it should be very clear how this mechanism works. Some vendors are currently in the process of implementing it in their systems, but we really do need to re-engage with the vendor and business communities to really push it so that everybody is aligned and compliant with this standard. And that's really where CDISC can help us, because obviously they're used to pushing standards out into the industry. There are many different use cases for this particular standard. Obviously, the main one that we've been focusing on is final transfer of TMF content from CROs to sponsors. But it could also be interim transfers. It could be transfer of information around study events, so things that are happening in the study. It could be for archiving purposes. There's a whole bunch of different use cases for this particular standard. We're really looking to CDISC to help us better structure the initiative and promote its use. And we'll also obviously integrate this into the CDISC library as well, so that it could be managed there. Finally, some of you may have heard of an initiative called Digital Data Flow, which is an initiative from Transcelerate that's also being developed by CDISC. And it's all about taking a digital protocol and then sort of providing that digital protocol to all of the downstream systems, and then allowing those downstream systems to consume the digital protocol, but also to exchange information between themselves. So it's really kind of creating that clinical system superhighway that allows us to push information around between systems, which is really what we need today. And it's, it's one of our big pain points. So that's really exciting as well. And we're actively discussing with the DDF team on how does TMF fit into all of this. Next slide. Third initiative and fourth initiatives are all around process implementation. So we're going to be looking at all of the CDISC processes for standards management and implementing those processes within the reference model. So it's more of a procedural thing, but it has to be done as we move to a formal standard. And then the second part of this initiative, so the fourth initiative, is around standards alignment and integration. And so, as Karen mentioned, CDISC has a vision for clinical standards as a whole, not just data standards, but all of the operational aspects as well. They want to have standards in place, and TMF is part of that. And so part of our job here is to ensure that TMF is integrated into that landscape. As DDF and ICH M11 standards evolve, so obviously these are all works in progress, we'll also be aligning and integrating the reference model standard into that. And so we'll be actively involved in the M11 initiative, which is great. You know, CDISC has obviously just received the mandate from ICH to develop all of the control terminology and everything else for M11, and so that, I think, is a big deal. And then finally, we're also going to be kicking off a project with the National Cancer Institute team that is responsible for developing control terminology. And so CDISC has already quite an extensive control terminology that's been developed by the NCI in collaboration with CDISC. And that team is very keen now to start working with us as a TMF community to develop the control terminology for TMF and make sure that it's part of the overall control terminology that's being managed by CDISC. And this is also really important for things like alignment with ICH M11 and just standardization and integration in general. So a lot of really exciting stuff happening, a lot of work. We have a lot of interest. We've got about 75 volunteers, I think, Karen, more or less.
Yep, absolutely.
Yeah, and we're all involved in these different work streams. We're going to be kicking them all off in the next few weeks. So watch out, here we come. If anyone is interested, you know, we're always open to additional volunteers. Obviously, we can't have hundreds, but if you are interested, reach out to Karen or myself, and sort of provide us with insight into why you feel that you would be a really good volunteer for one of these groups, and we'll definitely consider bringing you in. And with that, I'm going to pass it back over to Karen.
So, Paul, there's been a few questions that have popped in, and echoing, that have popped in. People were asking about what does DDF stand for, and Brendan very kindly said digital data flow.
Yeah.
I think it's just almost trying for people to understand what do we mean by that, because it sounds quite sort of techy, but it's basically an example. Can you give us an example?
Yeah, so digital data flow. So the first examples that we're seeing coming out is more on the clinical data side, but it gives us an idea. So, for example, just recently, I think it was Novo Nordisk released a solution using digital data flow where they could read a digital protocol that had like the schedule of visits for each subject in the trial. And then they were able to use that to configure their EDC system and all of the CRF pages that were required for each of those different visits by reading the digital protocol that was provided using the digital data flow standard. And so, you know, it's basically one use case is being able to read that protocol and then configuring the system. So if we think about TMF, it's also important for us to know, for example, you know, is this a randomized study? Which countries is it going to be running in? You know, when is the study going to be starting up? You know, there's a whole series of parameters that could be contained within the protocol that we could use to configure our TMF system. Now, we could also, you know, potentially even navigate our TMF using the digital protocol. And then finally, if you think about TMF, it's not just about documents, there's also information contained within other systems like the safety system, like the IRT, like the EDC, CTMS, that all contain information that could be TMF relevant. So eventually we would like to be able to access this information using this digital data flow standard. So it's really a data standard, and it's a mechanism for being able to interconnect systems. I strongly recommend maybe Googling digital data flow transcelerate, because there's a whole bunch of videos online that explain it in more detail. And it's quite a big thing, so it's difficult to explain in a few minutes here. But go and have a look at the videos; they're really good, and it will become much clearer.
And I think one of the exciting bits is, going back to the presentation that you did at the very beginning on completeness, is the fact that you can actually use the protocol to tell you bits of information. There's so much information that's scattered all over the place. That's what we're going to be doing in mapping in objective number 4. So I think it's really exciting, definitely. I don't think there's a couple of questions in here, but the one I think that is relevant, in fact, no, let me answer the first one, and then I'm going to come back to you, Paul, for the second. So Joanne was asking about there's an update to the reference model being completed. So there is a new update to reference model, version 3.3. It's actually going to be announced at the meeting, or presented at the meeting on Tuesday. The announcement might go out tomorrow or Monday or Tuesday. I'm not totally sure yet. It's a minor release. There's not a huge amount of change. So Joanne, yes, hang fire, because it's going to be there. It's actually dated the end of March, I think, because it's been going through a review process. But that's just small changes. The question that we've got here, Paul, is would there be a new release prior to the migration into the CDISC library? And I know you and I have talked about that.
Yeah, maybe. Right now we don't have a clear answer on that, because we, first of all, the first thing that we're going to do in that work stream is evaluate the reference model in relation to control terminology that already exists and other standards that exist in the CDISC library, to see whether we need to make some changes to align before we migrate over. So we'll know more, I would imagine, in a few months' time. So right now we don't know yes or no whether that will happen, but we'll definitely keep the community informed of how we make progress on that. And obviously, as soon as we know whether we need to produce a new version or not, we'll definitely tell the community.
Okay, no worries. That's great. So there's a couple of other things I wanted to touch on that were raised as questions that were not totally related. So one, and it's made me smile, Rhonda, thank you very much. With the continued interest to have an industry standardized ISF, are there any plans there? Now, for anybody who knows me and who's known me for many years, it's my little obsession that we need to have an ISF, something to standardizing the ISF. I think there is a chance, based on a few conversations I've been having recently, that we might actually be heading in that direction, where we talked about a CDISC becoming a more broad clinical research standard. The investigator is in the mix. So I can't promise anything, but I know there's some very active conversations at the moment going on about that. Ken was asking, the management of the EMS LinkedIn group be migrated to CDISC management. I can actually answer that one. Yes, Ken, we should have done that already, because they've taken over the reference model one. So ping me and we will sort that out for you, because they do, as I said, they do the reference model one now already. I can't see any other questions other than a question: is the library getting updated data? I'm not sure I understand that question.
Maybe there was one question that you answered, Karen, just in text, but it might be worthwhile just reiterating. Will the conference be virtual or in person? I think we're talking about the TMF interchange, and it's very much in person. So I encourage you to register for that conference and come and hang out with us. It's going to be fun.
Oh, it's going to be too much fun. Sorry, I had to get that in there. Okay. I'm going to carry on very quickly. I don't think there's any more questions. Just carry on very quickly and talk about the future. Hopefully you've had a safe flight, and as we're coming into land in the future, and our pilots gone to sleep in the corner. No, hopefully he's still focused. This is just a picture that I want to put up, and I get very excited about this picture because it sort of puts us in the middle of it all. We're no longer, we are absolutely central to the clinical trial information flow. CTMS, ETMF becoming very sort of merged and overlapping in terms of data. Really CDISC always focused on this sort of stats analysis, ePro, that sort of bottom rung. And now we are taking a step back and becoming an overall clinical research standards. So it is exceptionally exciting and allows us to really focus in on our strategy pillars. So I talked at the beginning about the fact we did the strategy session. The first pillar was evolution, and it was a new way of managing the model, and that's why Paul and his groups are going to be incorporating into the library, etc. We talked about community as one of our strategy pillars, and making sure that we had continuity, good future leadership, vision, etc. And I think because we are now part of a bigger organization, this has definitely given us continuity. This reference model is not going to sort of drift away at any stage. Formalization, we want to align with the regulators. We want to we're now a stakeholder in the EMA database. And the last one was expansion, information and expertise sharing. So we have a training program, we have a TMF interchange, and I am going to, hopefully Oliver's on here, and ask if maybe when you follow up after this whole conference, maybe we could include the links for the abstracts for the 31st of May and for registering for the conference, and for actually those are probably the two key things, because we really do want to get people to come as much as possible and make it a success, because if we make it a success, we'll then have one in Europe, and then we'll keep going within the States. So in summary, it's fun. There's lots going on. Hi Oliver. There's lots going on, and thank you. That's Paul. Anything further to add?
No, I'm really excited. I think there's such a big opportunity here, and we're really sort of taking it to the next level here in terms of the reference model. So it's great, and it's great, Karen, that you're also now part of the CDISC organization to really move it forward there too. So, thank you.
Oh, absolutely. I am actually, if anybody needs me, my email address is kroy@cdisc.org. I will put it in the chat just in case anybody wants to get hold of me to discuss anything related to CDISC.
Perfect.
Thank you so much, Karen and Paul. This was absolutely amazing. Lots of engagement, lots of questions. We love to see all of that. I'm just going to ask you, Karen, if you could sharing your screen. Just going to.
Yep. No problem at all. No problem. There you go.
Thank you so much. Okay. So up next. Okay. So thank you everybody for joining our very first session on J3. So just want to let you know that the next session is going to be at the top of the hour at 11, and it's going to be with Terry Andrews, Thinking Differently, getting the TMF to work for you. So that's going to be at 11 o'clock. Just to let you know, that networking is all part of TMF Week. So head on over to the lounge, go to the monitoring booth, just get to know people, connect with them, chill and have a good time. And last but not least, we are running a TMF Pulse Check survey contest where you could win a pair of TMF Converses. The only thing that you have to do is just enter in the survey and give us some of your information, and you might be a winner of these lovely kicks. So I just want to say thank you once more to Karen and Paul, and thank you all for joining us for our 9 a.m. session. We really appreciate it. Like we said before, you could be anywhere, and you chose us. So thank you so much for that. Have a great day, everybody.
Thank you. Thank you, Kim. Thanks, Karen. It was great to talk. Bye-bye.
I'll head over to the lounge and have a
Head
cup
over
of
to
tea.
the lounge. There you go. Bye.
Bye.
Bye.